Can you talk to me about who will be a priority for vaccination?
Right, there's four high-risk priority groups who've actually got particular health needs. Those are people who normally receive the seasonal flu vaccine between 6 months and 65. People who, for example, have got chest problems or heart disease, diabetes. Also, pregnant women are particularly an at-risk group who will be offered the vaccination. People who live in a household where somebody maybe has a serious immune problem, they'll be offered the vaccination to protect that individual in the household. And the fourth high-risk group will be the over 65s who've also got heart, lung problems. Again, they'll be offered the vaccination. And then for health and social care staff, we particularly want to vaccinate people who are dealing with patients, frontline staff, who may themselves be at risk from contracting flu from either the patients or actually giving those individual patients flu. So we want to encourage them to be immunised.
Why are healthy people over 65 and children not in the first priority group for the vaccine?
Well, healthy people over 65, many of those will have acquired immunity to swine flu. It was circulating in the 50s and some of them will be immune. And also for children, obviously most children have had a very mild illness and are generally healthy, so they're not a priority. It may be as we move forward and assess the vaccine and the impact of swine flu, there may be a different change in national guidance.
How will people be able to confirm if they are eligible for the vaccine?
If you're in one of the four high-risk groups I mentioned, then you'd be called by your general practitioner and you'd be able to receive the vaccine at your local GP surgery. If you are employed in health or social care and in one of those frontline staff, then your line manager will actually be able to advise you and you should receive a letter from your employer.
Is the vaccine safe?
Yes, it's as I say, produced in the same way as other vaccines and certainly has been trialled and there have been no serious side effects. Obviously with the new vaccine there will be ongoing monitoring and like any vaccine you can maybe get some slight swelling at the actual vaccination site, but in terms of overall safety it is safe, yes.
Can the swine flu vaccine be given at the same time as other vaccines, for example the seasonal flu?
Yes, because it's inactivated, it can definitely be given at the same time as the seasonal flu vaccine. It's entirely safe to do so.
Is it compulsory to have the vaccine?
No, like most vaccines, they're actually voluntary to have the vaccine, but obviously I would particularly encourage people to have the vaccination if they're in a high-risk group. Then if they do get the swine flu, they're more likely to have a complication, and if they're in the front line dealing with patients or clients in social care, then obviously it's important to protect themselves, their clients and their families.
If people think they have already had swine flu, do they still need to be vaccinated?
Yes, obviously swine flu has very similar symptoms to other types of flu. You can't always tell whether it definitely was swine flu. It's entirely safe to have the vaccine even if you have had swine flu, and I'd recommend that people go ahead and have the vaccine.